is presented as hurdles to the implementation of the project. Maneuvering the hurdles that were presented, it revealed the glaring gaps presented in this abstract. I will now hand over to Fosca to speak about how they overcame this. Thank you.
Thank you very much. Once again, as I was saying, Uganda subscribes to the 95 target, and spearled by the Ministry of Health in Uganda, we came up with a strategy to achieve the first 95, and that definitely needed policy adjustments that were crucial to create a supportive environment for HIV self-testing, which is novel and was new in the country. Significantly, policy reviews began in 2016 to facilitate the HIV self-testing strategy. And this led to the expanded target populations for HIV self-testing. In the beginning, we do know that for newer models of testing, there will be limitations in terms of who can use it and when they can use it and what services they can get thereafter. And this led to also a reduction in linkage period for confirmatory testing and emergency care, and an inclusion of blood-based kits for HIV self-testing to provide PrEP. And there was a transition to a streamlined supply chain for distribution of HIV self-testing products and a revised MHIS tools to ensure that there was proper reporting for HIV self-testing results and any data that would be useful for decision-making. And in 2020, there was a rollout of HIV self-testing in the private sector. Again, we very well know that most of the initiatives begin with public sector, where government has more control and is able to test out a lot of things before it comes to the private sector. However, because private sector, being what it is very dynamic, it needs a lot of investment. There were a lot of policy gaps and challenges on how to navigate that. So we found that a little bit behind, please. Behind? Next slide. There, thank you. So there was a lack of guidance on distribution of HIV self-testing products, for example, and there was hindrance on the demand and supply of these products through non-traditional settings. For example, supermarkets, can we have HIV self-testing kits there? Can we have vending machines? But there were no policies to guide this. So to ensure that the private sector was catching up with the public sector, there were policy shifts, and these created opportunities for implementing partners to test out the different elements. And therefore, Population Services International Uganda co-created with different communities on how to support demand creation and access to information and products on HIV self-testing. Together with the Ministry of Health, a board of directors was created to ensure that policy reviews continued to promote HIV self-testing in the private sector. And part of the co-creation results included a chatbot that would support HIV self-testing information dissemination and service linkage for those who use self-testing products. We also had a toll-free line that would be very helpful to ensure that the linkage was complete, but there was also self-reporting to ensure that the data from self-testing got into the right databases for decision making. And we also found out that communities preferred to work with social influencers who would definitely understand their situations and therefore address their fears, address their concerns, and roll along with them on their journey. And then, because definitely in private sector, there is need for money, HIV self-testing products were put together with other sexual reproductive health products like lubricants, condoms, etc., to ensure that when you got one, you got a full package. And that slightly reduced the prices, but also the trips to the pharmacies or wherever you were getting the kits from. So these innovative tools collectively informed a multifaceted approach to overcome the barriers to adoption of HIV self-testing. And we leveraged technology, so we had a lot of digital and social media campaigns. We worked with influencers on their pages and in radio and whatever platform that they would use. And what were our results or the lessons that we learned? Appropriate policies, definitely coupled with proper guidance from the Ministry of Health and other authorities, significantly improved our results. And there was a dramatic growth in terms of HIV self-testing adoption from about 20 times the sales of approved HIV self-test kits in just central Uganda, particularly Kampala, Mukono, and Wakiso, which is the Kampala metropolitan area. And there was a notable reduction of 56% in non-approved kits that were sold as HIV self-testing products. And extensively engagement of over 1,800,000 people on social media. And I have to quantify this. We have about 2.1 million people on social media, and our campaign reached 1.8 of them that also engaged with our content. There was data-driven expansion of policies to support such interventions. And this was seen through the National Drug Authority coming on board to guide how to create demand for these products across different platforms. And then PSI delivered accurate information while maintaining quality standards on outlining the policies. As we worked with the different pharmacies, we ensured that they understood what the policies said and went beyond to just providing a self-testing kit, but also to explaining further how to get extra support after you have used the kit. So what are the next steps? Emphasizing the importance of continuous policy review. We do not live in a static world, and health is definitely not one of those static environments. So the policies have to keep up with the changes that are happening, both in the communities, in terms of the diseases, in terms of the products that are being produced to contend with all these challenges. We suggest that policy amendments expand HIV self-testing distribution channels into vending machines, online pharmacies, drug shops, small clinics, VHTs, to ensure that these life-saving products are reaching the grassroots levels. And we highlight the need for reclassification of HIV self-testing products into general sales lists to increase their distribution and access. We emphasize the need for resources to support policy reviews and implementation.
You have 1 minute.
All right, I'm finalizing. So it is important that there is a catalytic role of enabling environments in addressing diverse health needs. And that speaks to integration, as we have had in the different sessions that we've been having. And we encourage the government of Uganda and all other governments to continue this commendable trend in policy review and expansion to facilitate the attainment of universal health coverage. Thank you very much.
Thank you so much, Fosca. You can switch off your mic, but please be seated there. Thank you. And she's right on time, has spoken within 10 minutes. And I will make sure you all speak within 10 minutes. I give you 1 minute, maybe a few seconds extra to wind up. We need to make sure that the audience can interact with you and not just listen to you. So thank you. That is one very important presentation that we've had. You create innovations and you run into policies which cannot support what interventions you've come up with. So now we're going to move to our next presenter, Ms. Princess Marire, who's going to talk about beyond metrics, how the simple participatory assessment of real change called SPARK 2 provides a holistic approach to advocacy measurement. On her bio, Princess is a young professional with experience and expertise in monitoring and evaluation of advocacy projects spanning over 5 years. She is knowledgeable in creating essential tools that enable advocates to monitor their progress, take stock of their wins, and document their results whilst harvesting learnings throughout the cycle of their advocacy initiative. Princess, over to you.
Thank you, Session Chair. Just to reintroduce myself, I'm Princess Marie. So I'll be taking you through this presentation where I'll be describing what the simple participatory assessment of real change SPARK is, why it is important, and highlight some of the lessons we have learned by referring to a coalition in which this approach has been used in measuring advocacy. So the name of this coalition is called ICASA, which stands for Coalition to Accelerate and Support Prevention Research. Advocacy happens within the context of social, economic, and even political influence. At the same time, there are multiple stakeholders who will be pushing the same agenda at the same time. This makes it difficult to attribute an advocacy result to the work of a single partner. This therefore calls for an approach that acknowledges these uncertainties while allowing advocates to measure the effectiveness of their results. So SPARK is an participatory evaluation approach that was designed for advocates to be able to collectively identify and examine whether they have individually or collectively contributed to the changes. I will walk you through the steps that are followed when one is conducting the SPARK. The first looks at what changed. Here, advocates are supposed to specifically state the result that was achieved and also go on to describe who was involved, where did it happen, and when it happened. In doing so, an advocate is able to present the result within the context in which it was achieved. The advocate then moves on to highlighting the significance of this result to the overall project goals and objectives. This ensures that the results are matching with what the advocates intended to do. We then move on to contribution, whereby there is to be stated the specific activities that were done by the advocates for these results to be achieved. For example, was it a training? Was it a webinar? Was it a workshop? That is listed under contribution. After having gone all through these 3 steps, the advocate then moves on to provide the evidence of change, or what we can say the means of verification. So when we are in SPARK, this can refer to pictures, social media, blog posts, articles, anything that shows that indeed the advocates were involved in the achievement of this result. How has SPARK been successful? Like I said, I'll be highlighting through the examples of the CASPA coalition. At the partner level, partners have been able to take a lead in identifying the outcomes of their work. So this means that partners have gone beyond just implementing activities, but they are now pausing and reflecting on the quality of their advocacy activities. This means that they are saying, in as much as we have done these activities, what is changing as a result of what we are doing? At coalition level, we have been able to document the outcomes of all the partners. So that means that we are becoming more outcome focused. We are not just implementing for the sake of implementing, but to continuously check in what ways are we contributing to the overall goals of the CASPA coalition. Therefore, the overall value of using Spark under this coalition is that it has enabled the harvesting of outcomes from a contribution, not an attribution perspective. The unique thing here is that partners are able to say, we have played this role for this specific result to be achieved, but we are also cognizant of the work of other stakeholders or agencies that are also involved in the work that we are doing. This slide shows some of the feedback that we have received from partners who have used Spark. And what we can say is that there has been a shift, a commitment to become more focused on outcomes and not just implementing activities. Next slide, please. Here are the lessons that we have learned when we have been implementing Spark. Spark allows incremental documentation of results. So on a quarterly basis, all partners are supposed to submit the Spark stories, whereby they'll be highlighting the changes they have achieved every quarter. In this way, partners are able to pause and reflect while checking what has changed as a result of their work. Another lesson has been that they've been able to establish their contribution to outcomes. They're able to know how they have done and what they have done for a specific result to be achieved. Another lesson has been that Spark is done collectively, and this has promoted a culture of learning, sharing ideas and perspectives. So there have been deliberate actions to create a shared space where partners can sit, have a critical reflection, have a dialogue on the outcomes of their advocacy work. In doing so, partners are able to share ideas on what works best, what can be improved, and how to strengthen those results. The last lesson has been that documented stories can be shared across coalition. This has been made possible by a quarterly newsletter that we have, which we call the Results Bulletin, which is an outcome-focused newsletter. This has been shared internally with our partners, externally with other networks of advocates, and even to our funders. In this way, we have been able to tell the story of CASPA. We have been able to demonstrate the value, the effectiveness of the work of the 11 partners that are on the coalition in the overall HIV prevention research agenda. Let me end by saying that Spark is an approach that can be adapted in contexts where there are multiple stakeholders pushing the same agenda at the same time. In this way, advocates are able to understand and to answer the "so what has changed" question. In this way, we can say that Spark can help organizations, can help advocates refine their strategies so that they can have a positive impact on the policy, research, and access. Thank you.
Thank you so much. Thank you, Princess. And that presentation is something that advocates really need to look into. And most of the time, we would tell the same story as 20 partners. And we don't know if everyone visited the same house and said the same thing. So to be able to say, what exactly is my contribution, will make us more focused and very welcome. So thank you for such initiatives. And we hope that we'll have a time for us to be able to talk a bit more about what you've said. And thank you for keeping to time. Princess is coming from Pangaea, Zimbabwe with AIDS Trust. And the next presenter is Joseph Unjoa. Mr. Joseph Unjoa will come and present about campus mail model, innovative tools for planning, monitoring, and evaluation of advocacy campaigns. He's also coming from Pangaea, Zimbabwe. Joseph is an advocacy programs and monitoring, evaluation, results, and learning specialist who is committed to marginalized communities' access to health. The key highlights of his career including influencing the formation of the first Savior National Technical Working Group on COVID-19, sexual reproductive health rights, HIV, and AIDS for persons with disabilities in Zimbabwe. So I will let Joseph tell us more about the campus mail model. Thank you.
Thank you, Chair. Good day to you all. So I'm going to be walking you through how Campus has been innovating, planning, monitoring, and evaluation of advocacy campaigns. So Campus is an acronym which stands for Coalition to Build Momentum, Power, Activism, Strategy, and Solidarity in Africa. It's a global north to south partnership of civil society actors that are working towards strengthening the HIV and health response in Tanzania, Malawi, and Zimbabwe through influencing improvements in policies, resource allocation and utilization, intervention systems, and processes. So I think we can all agree that advocacy occurs in very complex and non-linear environments, mainly because most of the factors associated with advocacy are difficult to control and predict. This being the case, how do we measure what we're doing, what we're achieving with our advocacy campaigns? How can we tell that our advocacy campaigns are making real and incremental change? Equally important is advocates, do they have the tools that can enable them to demonstrate the value that they're adding to the HIV response? To answer all these questions, critical investments need to be made in a strong monitoring, evaluation, results, and learning system. So firstly, I'll walk you through the campus advocacy mail model, which essentially has three elements. The first bit is we have a campus mail hub where we have the leading partners that are responsible to provide coalition-wide support to all the partners within campus. To do this, they use three specific tools. Firstly, they have the landscape analysis and strategic action planning tool. Then they have the campus campaign advocacy assessment tool. And lastly, they have the simple participatory assessment of real change tool that Princess was speaking to. So all these tools are consolidated in a mail handbook that provides a step-by-step guide for all the partners whenever they want to maximize on these tools. In terms of application, we have the Mail Champions program, which is essentially partners that have volunteered to learn more about mail and provide that support in real time in the 3 countries. We also have the Strategy Lab. We are very deliberate in creating spaces for campus partners to come together and develop sound advocacy plans. We conduct virtual and in-person trainings. We conduct reflection meetings, and wherever necessary, we also provide one-on-one support. So I'll begin by talking about the landscape analysis and strategic action planning tool, which is the tool that we use to develop our advocacy campaign plans. We essentially go through 7 steps. The first step is being able to define the problem or the topic or the issue. From there, we want to think through what is really causing this problem, and we want to then come up with our advocacy issue. Some of the techniques that we used includes the asking why methodology, the fishbone analysis, and also we cut an issue. So for campus, to say we've got an advocacy issue, it has to have 3 main elements. The first key thing is we need to be clear on what the problem is. The second key thing is we need to be clear on what the solution to this problem is. And lastly, who has the power to give us the solution to this particular problem. So now that we have the solution, we move on to the next stage because we essentially have our advocacy campaign goal, which is then thinking through those incremental changes that we need to then achieve our campaign goal that makes up our objectives. From there, we want to then be able to define who our constituency is, who our allies, and who our opponents. After we've done this, we also need to think through what are their interests in relation to the advocacy agenda that we're pursuing. So from there, we move on to the 5th step, which is around power and support mapping. We want to be able to place our allies and our opponents on a power and support matrix. Of interest to us are those stakeholders that have high power in relation to the agenda, but low support to our issue. So, which then brings us to the tactical planning phase, where we want to migrate these partners that have high power, high influence in relation to the agenda we're chasing to a point where now they have high support of this agenda. So basically our tactics, our activities are designed around ensuring we get the right people in the room. And if they do not support our advocacy agenda, we want to ensure that they then begin to support this agenda. Lastly, in our campaign planning process, we look at what do we need to win. Here we're thinking through what already do we have in our arsenal, but equally important, what are those things that we need to achieve this win? So it could be in the form of technical resources, it could be access to spaces, it could be financial resources, but we need to think through what are those things that will then get us there where we need to get to. So the next tool I'm going to talk about is the Campus Campaign Advocacy Assessment Tool, also known as the CCAT. This tool, we use it to assess the advocacy wins that we're getting. And at times in advocacy, you can also experience setbacks. So when we do experience these setbacks, we want to be able to qualify and quantify what this looks like. So the first step to this process is reflecting on our campaign goals and objectives. And here we're thinking through whether our objectives and our campaign goal is still speaking to the context. From there, we want to be able to identify those wins and the setbacks that we're experiencing. I think of equal importance is we have what we call a partial win. This means we've actually made some significant ground in terms of achieving our campaign goal, but we can also have a full ultimate win, which means we've actually realized our advocacy campaign goal, but we can also suffer a setback, and we need to be documenting all these key processes. From there, we rate our wins using a 0 to 4 matrix, looking at 3 main variables. The first thing we look at is significance. So how important is this outcome that we've realized in relation to the goal that we're working towards? If it's really important, it gets a rating of 4 with the full substantiation of how we got that value. From there, we move to influenceability, where we're thinking through those tactics that we've deployed that have resulted in this change. Equally important is recognizing other actors that are working on the same issue. So if our influence has been significant, again, we give a rating of 4, then we also substantiate why we think that we can give this rating. Lastly, we look at durability. So here we're answering the question, how long can this change be sustained over time? You can appreciate that some of the changes that we get in advocacy, some of them are short-lived, some of them can save populations over a longer period of time. So lastly, if we've experienced a partial win, it means we need to come back on the tactical planning table and think through what are those follow-up actions that we need to actually translate this partial win into a full ultimate win. Similarly, if we've suffered the setback, it means we need to also think through those follow-up actions that we need to ensure that we save our campaign, because we've actually suffered a setback and our campaign has been derailed. The last tool, which I won't labor too much on because I think Princess has done a marvelous job, is the simple participatory assessment of real change. But I'll essentially speak to 2 main points. The first 5 stages that you're seeing are mostly about reflection, where we want to bring in as many stakeholders beyond the people that are working in the organization. So our allies, the people that we worked with, and get their multiple viewpoints on this change that we're noticing. So by the time we're identifying our most significant outcome, where we then develop our spark story, we are clear on what this change looks like from varied viewpoints. The last 5 stages are there now to guide us when coming up with our spark story. So we need a strong title. We need to be clear on what happened, and that is specifically the change that we're noticing. We need to note how significant is this change in relation to our campaign goal. We need to be clear on our contribution, but equally important is noting the other players that have also contributed to this change. And lastly, we need to be clear on the supporting evidence. So I've also taken time to show you a newsletter that we developed as Campus that was as a result of this particular
I'm
process.
giving you 1 minute.
Yes, I'm on my last slide. Thank you, Chair. So what are we learning? I think the first key lesson is for you to maximize on utilization of these tools, you need to use participatory approaches. I can't emphasize enough on the need to bring in actors or people that are working on, that have played a key role in the change you're realizing beyond the people in your organization. So it has to be consultative. You need to bring everyone on the table, and you need to be clear on what this change looks like. The second lesson is around the landscape analysis and strategic action planning tools. For advocates to be able to achieve real change, they need a solid and clear plan on how they are going to go about this change. And this tool helps advocates do that. The third lesson is around the campus campaign advocacy assessment tool, where we've standardized and systematically presented a way for advocates to be able to document and identify the wins and even the setbacks that they're experiencing from an objective level. And I think the last lesson is around the Spark tool, where advocates can be able to tell the story of the advocacy journey, and in so doing demonstrates the impact that they're contributing in our response to HIV and health. So in conclusion, what I'm saying is advocates need these tools to be able to develop solid campaign plans. They need tools that can help them objectively in a systematic and standardized way, be able to demonstrate the outcomes and the changes that they're influencing, whether it's policy, resources, and everything that we're working towards. And lastly, they need to be able to tell the story of the advocacy journey. Over to you, Chair.
Thank you, thank you. Hasn't it just been amazing to listen to young people articulate issues so well to all of us, showing, and most of the time they would read, but they were not even reading, they would just go on and speak what it is that they are doing. And that makes you know that they sit and are sitting in the room and having these discussions, which is amazing and gives us a lot of hope that we have a generation which is really grasping what they need to do. So we started first with talking about self-testing and how interventions that were planned when they were about to be rolled out realized that there are hurdles in policy and they needed to look at how can policy be amended. Next, we came to talk about advocacy and how we can measure the change, our contribution, not attribution, but contribution. Am I mixing them? Yes. So making sure that we can be able to say, this has changed. What did we contribute, or what did I contribute to this change? Finally, we've been told about the various models, tools that are available for us to be measured that advocacy. We have time for a few questions to them. They have done a wonderful job telling us what it is their abstracts are about. So now we need to hear from you. If you have any clarification, any questions, please. And can I be helped by the volunteers to give them, the people in the audience, a mic as they ask these questions? So I have a question at the back. I have one in the middle. Do we have a mic for them? So we start with in the middle, then we go to the back. The back on my left first, and then we will go to that one you've given the mic. There's one at the back on my left, right at the end. No, you go ahead and ask your question. We'll take all the three questions at once, don't worry.
I can go in the meantime.
Okay, please go ahead.
Yes, thank you very much. My name is Simpiwe. I work with the UN system based in South Africa. My question is for the first speaker from Uganda, and she made reference to working with the private sector and knowing that the private sector is the most complex out of the horizontal sectors. I'm talking government, private sector, and civil society. Can you reflect on who you're referring to when you say private sector? Because those complexities, private sector is comprised of individual businesses, some big, medium-sized, or small. Private sector foundations, there could be informality there. So if you could just share, because I'm worried, you mentioned private sector only to find out you're working with Uganda Party, and then that becomes private sector. Thank you.
Next question.
Great, thank you. Jacques Amang from Namibia. My question go to the first presenter is about the private sector as well. It can clarify as my colleague alluded. So I just want you to comment a bit on the linkage to care, because one of my supervisors have been emphasized on don't test someone if you are not able to link to care and put on treatment. So this innovation will reach as many as possible, and you will bring more positive results. How do you link this client into care? Thank you.
Thank you. Another question. I've seen someone at the back on the right. Yes, please.
Hi, I'm Meg Ginnivan from the Clinton Health Access Initiative. That was my question, as well as on how we're defining private sector, whether it's for-profit or not-for-profit. But then the other question I had was, if for-profit, is there a price point associated with the self-test kits? And if so, what were the price controls in place? Thanks.
Okay, do we have any more questions? I need to make sure that all these young people in front say something. Okay, someone on advocacy, thank you.
Hello, my name is Remy from the Orem Institute. I think for the first speaker, really reflecting around policies. Sometimes I just want to understand how you might have dealt with the policy misalignment. So you might have worked with the fact that for self-testing, the policy allows or doesn't allow you, and then you overcome that. And then you realize down the line that there's some sort of other overlapping policy that is also influencing your work. And that can also affect rollout, right? So I wanted to know how you navigated that, if you actually faced that, and then just thinking through whether the board of directors was able to influence that or not. So just want to understand how best you navigated those differences in the policy misalignment